This bone is clavicle. The clavicle that's S shape, okay? But pull from each other, and that's like S. It have a two end. The medial end is circular and enlargement, and lateral end or acromial end is flat. The medial end is external end because the external end make a joint with sternum, sternoclavicular joint. Here is a sternoclavicular joint, and here is the acromioclavicular joint. This process is acromial. Medial end and lateral end, or external end and acromial end. It have a this is a superior surface and inferior surface. For determination of side, look here, the medial 2/3 is convex and 1/3 lateral is concave. Okay, so it's in this position. You can see the inferior surface have a subclavian groove and conoid. So here is the inferior. That part is the anterior, and superior is soft. So the medial is here and lateral is here. That is belong to the right side. This position is in an anatomical position. Okay, it have a two end, the sternal end and acromial end. Superficial, that's a superior surface, and inferior surface. Anterior border and posterior border. In anterior border, sometimes you can see a tubercle here. This is a deltoid tubercle. That's for example, here we have a muscle, that's a CM. In the posterior we have a muscle, the sternothyroid. Here for the trapezius, and here for the deltoid. Sorry, here for deltoid and here for trapezius. But the important bone marking are in an inferior surface. I have told you we have a 4 bone marking here. The first is the impression for the costoclavicular ligament. So here is a costal impression or costal tuberosity. This groove is some less deep. This here is a subclavian groove, and near to the posterior, look here, there's a posterior. Okay, near to the posterior we have a conoid tubercle, and this line is trapezoid line for the attachment of trapezoid ligament. Again, for review, have a two end, sternal end and acromial end, superior and inferior surface, anterior border and posterior border. There's a costal tuberosity, subclavian groove, conoid tubercle, and trapezoid line.